Good afternoon, everyone. Welcome again to another series of the Momentum panel by Ecochild Africa, where we have a group of experts, both with experience and knowledge, discussing about children with disabilities and the policies and processes and systems in best supporting them. Today we're discussing about the Sustainable Development Goals, coming halfway to the goal, which our target was 2030. But before we get into the discussion, I will give you a brief of who I am. My name is Jeremiah of the Jeremiah Foundation. I am based in Kenya and I am a person proudly living in cerebral palsy, and through my experiences, I advance the lives of children and adults with cerebral palsy and their caregivers through awareness and advocacy. That's why I'm also known as a necessary noise maker, and also through early intervention and support systems. I am very happy to be chairing the session today. I will throw the ball to my partner and they can give us a brief introduction of who they are. But before a brief introduction of who they are and where they are coming from, um, if you have any questions or concerns, please post any of the questions you have in the chat box, and we also have closed captioning for any accessibility needs that are possible to June. June, may you introduce yourself?
Thank you very much, Jerry Maria. And hello to my co-panelists. My name is Juno Mwene. I'm the Development Director at the Action Foundation, where we work to build inclusive and resilient communities for children with disabilities. So our work is geared towards disabilities, and I'm glad to be here. Thank you.
Thank you. Sharon, you go ahead.
Yeah, thank you so much, Maria, and good afternoon, everyone. It's afternoon from Kenya. Yeah, my name is Sharon Luma. I work for Action Network for the Disabled. Action for Network for the Disabled, ANDI in short. We work for children and youth with disabilities, as well as caregivers. Our thematic areas includes education, health, sustainable livelihood, climate justice, and advocacy, which cuts across. I'm glad to be here and participate in this discussion today. Thank you so much. Back to you.
Thank you, Sharon and June. And finally, to Africa. You're welcome.
Thank you, Maria. I'm Niyonzima Afik. I'm a Rwandan. I work for Uwezo Youth Empowerment in different projects. My position is lead disability youth advocate, where we advocate children with disability at different sectors like government officials and the other stakeholders. Thank you.
Thank you. Thank you so much. People with disabilities comprise of 16% of the global population, the most diverse in the human society and the most underrated human capital. What do we use for not tapping into this diversity? People with disabilities um, are profitable to the communities, but the problem seems to be we can't include them. But mostly, we as communities with diverse perspectives don't know how to include them. The SDGs, the Sustainable Development Goals, summit took place between the 19th to the 18th to the 19th of September in New York. It marked the beginning of a new phase to accelerate progress towards the sustainable goals with the high-level political guidance and transformative actions leading to 2030. During the SDG Summit, we noted that stability benefits all. And according to the summit, nearly 50% of the SDG targets have been monitored of track. However, there are needs and immediate cause for action. My question is, having 50% of the SDG targets tracked off, how much of them have remembered to consider the promise made to leave no one behind? So now going forward and into this conversation, we will dig deeper into understanding in the different countries we are coming from, where are we in the sustainable development goals, and have we kept our promises to children and people with disabilities? So let's run off. What are some of those factors that are contributing to the failure of the SDGs for children with disabilities?
You're on mute, Maria.
Sorry about that. Thank you, Jude, for that contribution. Yeah, data and the cost, finances, go big thing. Africa, you wanted to add to the conversation?
Yes, thank you. John said everything, but I want to add the climate change. The climate change today is a big challenge. We are looking the solution after the floods, the rainfall, if the rainfall kill or make the children with disability absent. They are absent in government or the disaster management policy. They are not included. I can give example in the last year here Rwanda, we faced the heavy rainfall. The I can say a command post. It's like a board meeting, which are there to solve or to give the solution to the person who faced the challenge at home. Their houses, they constructed, the flood are there, the Lord, and just many things. But the children with disability or persons with disability in general are not considered. They are giving solution, they are giving support to the camps, but not remembering the children with disability. I can give example. There are children who have a white cane, and the fruit take the white cane, and he's still with nothing you have to take. But they give them the whole family a food, a basic needs, but not a white cane. Just he needed for daily life, but they don't consider him to give them to give him that basic, and I can say it's basic right. It's a right to have mm, those sorry, it's a white cane. Thank you.
The assistive devices, and it's always an argument that some people see as if assistive devices as additions, yet they come as necessities for person with a disability, and it's such a necessity. It has to be budgeted into the budget allocation of the government. So assistive devices are a big conversation, even in Kenya. Um, and also adding to the climate change is I have noticed when the climate changes or when it's cold, children don't come out for therapy. So you find children missing months of therapy because it was raining, the weather changed, and for me, missing a day of therapy matters so much for the cerebral palsy. So yeah, climate change also is a factor contributing to the failure of the SDGs. Sharon, do you have a point to add on a factor failing or a factor we should address?
Yeah,
So, touching on political goodwill, touching on finances, data, climate change, assistive devices. What have what is the role of OPDs and other disability organizations in the SDGs for children with disabilities? June, and now you and the Action Foundation have been quite active in advocacy for education for children with disability. What other roles can OPDs play and other organizations play in realizing data, political will, financing? What can we do?
Thank you. So I believe that one of the best ways that OPDs and other disability-focused organizations can support the realization of the SDGs is we have to intentionally engage with the political class. It's very wonderful when you're able to identify areas of synergy between the work that we do and the goals and the aspirations and the plans for our governments. So for instance, at the Action Foundation, we've really worked to get support and technical discussions with the Ministry of Education, with the Nairobi City County, because we realized that for us to achieve our goal of reaching all the children possible with disabilities where we work, we need to strengthen the existing institutions. And that sometimes takes the form of, one, engaging politically through advocacy. And this means that we could create solutions with our leaders. We call them to meetings and we say, this is what you're thinking about. How does it fit into your plans? How do you think we can do it better? What gaps are you really experiencing? So that then our role as civil society is really filling in the gaps that the government is experiencing. Something else I believe we are in a very good position to do as civil societies and people, organizations led by persons with disabilities and working for persons with disability, is we need to support the families of children with disabilities to be self-advocates. How do we, like Sharon alluded to, get them to be on the table where decisions are being made? Why? Because they have the lived experiences. So we need to be strong allies if we are not an OPD organization and saying, I want, for example, adolescent girls to go into discussions where we're talking about the need for higher education, the need for STEM education. We need our caregivers to be in discussions around health funding. We need our children, the voices of our children to be heard, and we are in a good place to facilitate that as organizations working alongside persons with disabilities. The final thing that I think is strong that we can participate in to support the journey to 2030 is because of access to resources that we have, we are able to create and research best models around disability inclusion. And these models are the ones that we take to our governments and say, this is a model that works, it's sustainable, it makes sense financially because we're doing it low cost. Can we embed it in systems that are already working? Yeah. So for instance, on the issue of support services for education, the Action Foundation has been testing a model on school-based therapy centers. Yes, because what happens currently now is that caregivers have to go to different places to get therapy for the child. And then, so you're going to one location for therapy, you're going to a different location for a nutrition intervention, for instance, and you're going to a school. So how about if we develop models that show that there's a cost benefit, there's an incentive to put all these centers in one place? Why? The parent only needs to come to school, and in this school, the child gets the 360 services, let me put it that way, that they need to continue on their learning journey. So when we test this model, then we find out what is the true cost of this model, and we take it to the people who are budgeting and say, we need X dollars or X Kenya shillings in a year to take a child with a disability through quality learning, because we've taken care of the assistive devices, we've taken care of the therapy at the lowest cost possible, but making it very, very accessible. So I believe our organizations are in prime position to do this because we have access to the communities, we have access to a lot of resources that can then help us to experiment and to pilot and to model best practices around disability inclusion. So I think for me, those are the key areas that OPDs, ODPs, and NGOs can support inclusion for children. Thank you.
I think as a summary, if they don't give you a seat, bring your own seat and sit at the table.
Absolutely.
So, Africa, what about in Rwanda? What are OPDs doing to realize the SDGs?
Hey, thank you. Here in Rwanda, there are like more than 15 OPDs. The common line we're on it is awareness of children with disability right. Sorry. Children with disabilities still they are there. Everybody today they know it's the children with disability light, but they're still in implementation. And today, what you are do is make sure those lights are implemented. Yes, we are doing advocacy, we are doing awareness, we are enforcing inclusion in every sphere environment to the child with disability. Thank you.
Okay. I like that. Same as in Kenya, right, Sharon? Is there any other role OPDs are playing? Or you think a role that you should be playing?
It's working together as OPDs.
Yeah.
Okay,
Yeah, you can go on. Africa.
Thank you. Andy said that to empower children. I remember one of our activity or our achievement. Here in Rwanda, we have a National Child Council. It's represented from village up to national. By empowering children, we encourage them, to be like another youth, and today, we have more than 50 children with disability representing other children in children national council. Yeah, it's like that. We work the way we are collaborating with parents, of course, parents, and them as a children and the mentor. You are saying it's they are a caregiver. Today here home we call them a mentor. We are mentoring the children at home and at school. That where we empower them and make them know their issue in order to raise it or to present other children at the Children National Council. Thank you.
Well, thank you. And I like how this conversation is going. I call it the magic touch, where as soon as you create awareness and you give them another identity, or you give children with disabilities or caregivers of children with disabilities a new identity, they have a flip and they are empowered and they are supported and they know they can conquer the world. So support, awareness, advocacy, all very important towards achieving the SDGs. But Africa spoke a lot about the children with disabilities. And I want to ask then, what is their role? What role do they play in advocating for the SDGs? And what can be done to improve their level of engagement? And I'm thinking of from the youngest to the more severe of disabilities, for those who can communicate, for those who cannot communicate, how can we improve the level of engagement in advocacy on the SDGs? June, want to start us off? Okay, I think Jim broke off. Sharon, what do you think? How can we engage our children in the SDGs?
Yeah, thank you, Maria. So I think children can as well be involved by, first of all, bringing them on board. We don't just
Thank you, Jerry Maria.
She's my
go
hygiene.
ahead, June.
You're breaking.
Yes, June.
Okay.
The thing that we need
Good, yeah, connection. Oh, and off she goes. So maybe Sharon, you can continue as we try to get June and Africa back.
Yeah. So I was saying it's very important to
And welcome back, June. Thank you, Sharon, for that.
Yeah,
And what you say, they also teaching other children without disabilities about children with disabilities so that they can also be part of their conversation. Yeah, that's very
yes.
important.
Yeah. Can I add something? Yes.
Yeah, sure.
So just picking up where Sharon left, one of the things that these days I reflect a lot upon is as we are creating these awesome, wonderful young children who can be advocates for themselves, I also wonder, how are we preparing the community to truly listen to their needs? And sometimes I know, even colloquially, we say a child with a severe disability, off the beach, they can't talk, they can't communicate well. But I usually say, even to our caregivers, I tell them, if we listen hard enough, every child speaks in their own unique way. And so one of the things that I think would be very powerful in supporting the engagement of children with disabilities is, one, we need to break down the communication barrier between children with disabilities and the rest of the world. I'm thinking of a child who has a hearing impairment, for instance. Thinking of a child who's visually impaired, there are different ways that they're able to interact with the world around them. And so we need to create it in a way that empowers them to share information, empowers them to even share their lived experiences. It's very easy for us to do that for adults, but even children have ways in which they can share their lived experiences, because there lies the lessons for inclusion. Because that is the most true, honest opinion you will ever get of a lived experience. Yeah. So something we've done at TAF is we have inclusion clubs in schools. And so the inclusion club is really a conversation guide. One, to help the child with a disability to communicate their feelings about the different aspects of discrimination out to their peers, who then start to empathize with this situation. So it's like a very usual conversation. A child with albinism telling their colleagues that when you call me Mzungu, this is what it makes me feel. Or when you call me this derogatory term, this is how it makes me feel. And so it gets us to the point where we are having our children get a human connection with their peers, because you cannot fight a human connection. At the end of the day, we are all in a society, we all want to belong, and nobody goes out intentionally wanting to hurt the other. So one, I think, very powerful way of engaging children with disabilities is giving them the spaces to express their true feelings, to share their lived experiences, because there lies the lessons for parents, for their fellow children, and more importantly, for people in decision-making spaces to see that this is the world our children see, even when they do not speak to us. How do we create a world where they can see different, or if it's something majestic they are seeing? Am I still on? I think I've wrapped up my
Yeah, we
points.
can hear you. Yeah. Oh, wow. Thank you. That's wonderful. Africa, you want to add it up?
Yeah, thank you, Maria. What I want to add is what we do today. We are collaborating with the government officials. We are showing that we are doing this and this and this. By you as a government official, you have to do this and this and this. For example, you said there is no sustainability without inclusion. Once here in Rwanda, there are a policy called education for all. But it can be for all, a person with disability can't access the schools. And like infrastructure, teachers, materials, everything. But it's a education for all. Today, we are showing them if you are going to contract the number of classes, please remember the little people with disabilities. Remember that wheelchair users can pass in your in this school. You have to give them accessible. We are here to tell them, please leave home, go to school. But is the school accessible? It can be a government official job today, and they are working. What I mean, we are working together with the government officials to make sure the accessibility or inclusion in all spheres, in environment, in society, in everything. We are telling them, please remember inclusive, remember inclusion, remember everything. We are doing this, but do this in order to promote inclusion. Thank you.
Thank you. And I like that no sustainability without inclusion, but not only inclusion, but disability inclusion. Aaron, you wanted to add something?
Yeah, thank you, Maria. I wanted to talk about play, which is also very key for children. We realize play, just play is something that interests every child, whether they're talking, they're not talking, they're moving, they're not moving. They enjoy when they are being included in play activities. So we encourage so much the teachers and the community around, including the caregivers, to come up with play-based activities that they can involve their children, whether the children are home-based and those who are in school, because that is the very first step of breaking the barriers to inclusion. So the moment they start playing, they don't see them as children with disabilities. They see them as play partners. They see them as this is a child that we can play a ball with. We can play maybe with the sand, and they're having fun at the end of the day. So it becomes the first entry point to inclusion at that very low level. Thank you.
Thank you for that addition, Charlotte. And just like in the beginning, we spoke about generations and how we are looking at generations of children. And as you were saying about play and playmates, I thought when we play together, we can live together, we can work together, we can exist together. When children with disabilities and those with disabilities play together, they are our future leaders, our future policymakers, our future educators, our future Secretary General of the United Nations. So if you have a Secretary General who once played with a child with a disability and understood their needs, understood their differences, understood their potential and their meaningful participation in the community, then we are looking at a holistic, inclusive generation brought about by just them in the community. So thank you for that addition. As a wrap up, and if anyone has a question, you can drop it in the chat box before 2030. I think we have how many? We have 6 years to 2030. So before 2030, what are the key changes that need to happen to ensure the SDGs achieve better outcomes for children with disabilities? And I want you to not only think out of the box, but think like there's no box. In this sense, we can talk about better data collection, better financing, better implementation of policy and practices. But what are the key changes? Like there's no box that need to happen before 2030. Africa, please start with you.
Thank you everyone. Let me say early intervention services. These early intervention services, I think it can identify the challenge, the support children with disability need to make them or to feel to solve their challenges they faced. It means today when I see the young children with disability, John said we don't have a number of children with disability at 0 to 4 age. It's because maybe I think it's because we call it disability when we are up to 5. This early intervention service will timely intervention can mitigate the impact of disability to improve the long-term outcomes. Means we will have the solution on the table to children with disability. We will have the solution at every angle. I think this early intervention service can have a good place or chances in SDGs. Thank you.
Early intervention everywhere, in every aspect, Sharon?
Thank you so much. Focusing on maybe Kenya, I think there's so much that can be done. We need to have a central our data system, because we have data that are scattered and they are everywhere. If we talk of children, lack of data for children with disabilities, these children with disability access services somewhere in a health center. They were born and recorded somewhere. So during the like the postnatal clinics, they go, that's where maybe the identification started. But there was no referral mechanism whereby you can send this caregiver somewhere to go, maybe start on the early intervention services. So we need to create referral mechanism for children with disabilities. We also need to focus more on disability awareness, and not just to the community, but also to the healthcare providers. Just the other day, we were talking about their curriculum. Do they really factor on issues disability? Because now, if you look at the statistics, right now we don't have polio. It is very low. But what types of disability are we having? Can we take a preventive measure to addressing the issue of disability? When do we start this disability conversation? Is it after or before? And when I talk of before, it's during, maybe after conception, because these people go for ANC. What conversation do we start there on disability to even prevent the issue of separations, and to increase the family support of children with disabilities? Maybe that's where the conversation needs to start, all the way back, yeah? We go for ANCs, but what are we told? We are told of nutrition. It's about the mother, and how they should take care of themselves until they get their children, they deliver their children. But how do we prepare them for anything disability, maybe as a family, yeah? How do we dispute the myth that disability came about because your family is cursed, or maybe it's in your genetics, or the blame games, yeah? How can we dispel the blame games? That conversation needs to start way back, yeah? So the other thing I think, and from there, when we're able to capture data at that level, and maybe create a data system that can be shared even with the National Council, then we won't be talking of data gaps. And then also, I think this need to establish clear links between the national, regional, and global activities to ensure disabilities inclusion is a priority at all levels.
Yeah, well, okay. Thank you, Sharon. Okay. So, thank you. Thank you, June. Thank you, Sharon. Thank you, Africa, for thinking like there's no box, because there's never is a box. By that I mean, yeah.
Okay, thank you. John said about financial support, and I remember it can happen with collaboration and partnership. These children with disability need more and good partnership in the government, civil society, organization, in every angles. They need collaboration and good partnership. Another things we need is research, doing research. Research can solve, can review the real issues which children with disability are facing. And research and innovation, I can think that it's a more useful in developing new technologies, in developing new well-being of the children with disability. and I also can say training and capacity building to what we said, caregivers, mentorship, to owner like Malia and John and whatever. We all need those training and capacity building seriously to become more professional what we're doing. We are building our opportunities just to understand the real need, the real support, the real challenge children with disability are facing. Thank you.
I cannot agree more. Thank you, Africa. And even as you were talking about those things, you have mentioned almost all the SDGs. And in looking at the SDG, it only includes people with disabilities 11 times. And disability is referenced in multiple parts of the SDGs, but in these conversations, we have mentioned them in all the SDGs. So, in conclusion, in order to improve the lives of children with disabilities, commitment is required. And not just any commitment, it's intentional commitment. We are talking about, just like you mentioned, an intervention. And it's good to hear Sharon talking about prenatal care because we are looking at maternal health care. We are looking at the levels of poverty that significantly influences mothers from getting that prenatal care and information. We are touching on access to healthcare, which for conditions like cerebral palsy, we are seeing an increase in Africa because of the access of healthcare. So, an intervention everywhere, an intervention to mitigate the situations. I love how we also need to commit into having a central data system. We are the data. We are working data. If all the OPDs can come up and say, okay, give me what you have, we have all we need. So maybe more collaboration, and more sustainable partnership are required for us to create a data system in a referral system that can be used, yes, in Africa, yes, in East Africa, yes, and maybe in the whole world. So wherever I go as a person with a disability, I can get my data in an OPD in that country. I also ask for your time and thank you for your expertise, for your knowledge, your wealth of information. Keep up the good work in your countries, in Canada, in Rwanda, in the UK, in the whole world. The fight goes on. We have 7 more years to go. Let's end it on a disability inclusive note. So thank you everyone for joining us for this conversation, and we look forward to having you in the next Momentum Partner by Able Child. Thank you. Bye.
Brilliant. Thank you. Thank you so much, everyone. That was really, really fantastic. I know we've overrun, so I won't take too much time. But Maria, fantastic job. Thank you, everyone. I'm going to stop the recording now.